Hi, this is Stephanie Seidman with CSH, and I'm presenting today on the Chicago Coordinated Entry System for the last quarter two of 2020, which has been a response to COVID-19. Really appreciate your tuning in. What I plan to do is walk through updates in the last few months with the Chicago Coordinated Entry System related to access points, the coordinated entry temporary prioritization plan that is currently in place, as well as temporary or interim contact protocols. If you're new to coordinated entry language, I would like to mention that access points are places where people who are experiencing homelessness can complete a housing assessment, and only people who have completed this housing assessment get connected to housing through the coordinated entry system. This includes homeless dedicated housing, such as youth transitional housing, rapid rehousing programs that involve shorter term lengths of time of a subsidy and case management, as well as permanent supportive housing, which is to say subsidized housing with ongoing supports. And so an access point typically was a physical place that we're referring to, and currently it's a virtual opportunity. So we have a coordinated entry call center, and you're very welcome to distribute this phone number out in any type of place where a person who's experiencing literal homelessness might be looking to complete a housing assessment. It's listed here on the screen at 312-361-1707. A few things to know are that it's open Monday through Friday from 8:30 to 4 p.m. That Catholic Charities Facing Forward, Feather Fist, and Heartland Alliance Health are all currently staffing this virtual access point, and that this does not help to bring about an immediate solution to the crisis of homelessness. So callers will hear that if they have called in for a shelter placement for that evening, they can go ahead and call 311 to request shelter, as well as if there is a longer wait time, such as more than a few minutes on this phone line, callers will also hear other phone numbers they can call directly, either where an assessor will immediately be able to complete the assessment, or they can leave in a message of how and when they'd like to be called back so that someone can be in touch with them. Again, this is for people experiencing literal homelessness who'd like to be assessed for housing. The next major shift in the past few months has been the launch of a temporary prioritization plan. So up until May, we had been operating with a plan that looked at the length of homelessness of each household and categorized people by longer lengths of homelessness or shorter lengths of homelessness. And then unsheltered status was the first of the tiebreakers. On April 28th of this year, the leadership team for coordinated entry adopted a recommendation offered by the Chicago Department of Public Health that I'm going to walk through in just a moment. And that's a prioritization plan that began being implemented on May 11th of 2020, with the notion that it is temporary, that it will be reviewed on a monthly basis, and that the first opportunity to make adjustments as necessary will be June 23rd, and then on a monthly basis as well, in consultation with the Chicago Department of Public Health. And all community members and groups are welcome to offer feedback and recommendations as well. The prioritization now looks at connecting people to housing who are at high risk for serious illness due to COVID-19 and have tested negative. This is, again, from the Chicago Department of Public Health, and set-asides were put into place and or honored as well. So to begin with, the first piece of this is promoting housing and connecting people to housing who are at high risk for serious illness due to COVID-19. That includes every single person who is age 60 and over. It also includes any person of any age with underlying health conditions identified by the CDC. And what's listed below are some examples and not all possible examples of underlying health conditions. that could cause a person or family to be at a higher risk. Youth, people who are unsheltered, and families with children can fall into that category of at high risk and tested negative, and also fit into set asides. So there had already previously been a set aside for youth, and this 10% set aside is simply being maintained in the temporary prioritization. What was added is a 10% set aside for unsheltered households, and this is in recognition that when the temporary prioritization was put into place, most testing was taking place in shelters, and so accounting for how to also be sure to connect people who are unsheltered to housing, as well as a 20% set aside for families with children. That is to say, when there are housing opportunities that could be for individuals or families, we would look to see, have we met our 20% set aside, and if not, would use those resources, such as rapid rehousing, for families. As part of the shift to changing prioritization, and within anything we do with the coordinated entry system, we pause to recognize that racism permeates every single system. Therefore, it's our job to account for systemic racialized inequities by ensuring that people of color have access to housing, healthcare, and in this case, because it is specifically people who are tested negative, the testing. In order to do so, the leadership team is on a monthly basis reviewing disaggregated data to look to see people who identify as Black or African American, if they're being tested, assessed, and housed in a way that's proportionate to their makeup of the homeless population. As necessary, there will be adjustments made. So just as an example, Hotel 166, the shielding hotel for people who are at high risk and tested negative, is receiving people who are then being prioritized for housing. If the makeup of Hotel 166 does not reflect the homeless population makeup, then there are still opportunities to offset this through set asides to ensure that if 80% of people experiencing homelessness identify as Black or African American, that 80% of matches to housing and people housed do as well. The last piece that I want to review with you today has to do with interim contact protocols that were put into place in this past quarter as part of the Chicago Continuum of Care Expedited Housing Initiative. Essentially, the goal is to house people as quickly as humanly possible, and that is to say there should not be barriers in place, and if there are barriers, they should be swept out of the way so that people can go ahead and move out of shelter and off the streets and into their housing. As part of that, housing providers must apply for applicable waivers to expedite the process and do anything they can within their own power, within their own rules, within their own tenant selection plans to look at what they can address to remove barriers to housing if that's related to documents people don't yet have but can have in the future. Then in that case, housing providers can simply document what they are doing, what will be necessary after housing, and supporting people to access documents from their safe and stable housed position. So for us on the coordinated entry side, what we do is look to how we can help with expedited housing within our own protocols. And there's a few numbers that I would love to offer an explanation for today. The first has to do with our timeliness standards, and it is number 5. It was in the past that providers could search for a person they could not find or a family they could not find for 10 days, and after 10 days, request a rematch. And we are now sharing that housing providers have 5 days to locate the household. If the household cannot be located within 5 days, they can be matched again in the future, but the unit should not sit vacant for any longer than is necessary, or the slot should not go unclaimed. And therefore, after 5 days, housing providers are expected to ask for a rematch. When people are connected to housing, it's really important that they understand declining opportunities delays housing. And so within the interim contact protocols, people and families may decline one or two opportunities for housing, but if once they have declined 3 units within a housing program, another household will be offered housing so that these slots can be accounted for and filled as quickly as possible. Our hope is that making people aware of this and then offering units within areas of interest will make it so that people can more quickly select a unit and move into it. At the same time, people who require a transfer can deny up to 3 housing opportunities, and after that will not be eligible for any other offers. And people who decline SROs will not be matched again to SRO housing if they have declined twice. Sometimes this takes place even though a housing assessment may indicate that the person would accept. The next key number is 15. So housing providers are expected to reach a point where the client is either on the way to enrollment or enrolled or a rematch has been requested within 15 days. And the idea is that if you, as a housing provider, do not update HMIS within those 15 days, it will be assumed the household did not reach one of these 3 places, and a new match will be offered to the housing provider. This is our way of saying, let's very quickly learn if you can serve this person or if you cannot serve this person or family and require a rematch so that this does not take weeks or months on end. The next piece to that is to think about the number 30. So after a housing provider has had 15 days to either work towards enrolling and or enroll, then they will have another 30 days to house the participant. The goal then becomes that within 45 days from the initial match, people are moving into housing. If it cannot be done, housing providers should email Chicago CES at catholiccharities.net and Bridget Doviet at bdoviet at allchicago.org to share why. Our hope is that part of learning why it can't be done can allow for the continuum to better respond to the needs of housing providers so that it can be done in the future. So this was an overview of some of the major key changes within the coordinated entry system in the past few months. And my contact information is below, email and phone. My hope is that if you have any questions or feedback or ideas, please feel free to reach out. And I so appreciate that you took the time to tune in for this coordinated entry Q2 update. Thank you so much and stay safe. Bye.